Dry eyes, are they really a big deal? Well, as a pharmacist for over 40 years, I can tell you they are a big deal. And I have a lot of patients come in seeking relief from dry eyes. And typically, of course, they want to know what kind of drops they can use. And of course, drops are always a mainstay of therapy in dry eyes. However, I'm going to go through and talk a little bit about maybe some other things that you may want to think about before you just start using drops to really help get a handle on this. And it's going to kind of surprise you, some of the ideas that we're going to present. But I'm going to go through and first talk about demographics, because dry eyes, of course, everybody knows what they are. They affect so many people in this country, millions of people actually. But the demographics across age groups, there's about a 9 or 10% of the population over 50 that says they have experienced symptoms of dry eyes on a regular basis. And 4 to 6% of adults and of adolescents and young adults, 4.6%. So 9-10%, about 4 or 5% of adolescents and young adults. Crazy. Here's another demographic, gender disparity. 61% of sufferers are women compared to 39% for men. And especially hormonal fluctuations during menopause can really be a real instigator for dry eyes. But as age increases and environmental factors, dry eyes can happen to both, but mainly more so with women, unfortunately. Types of dry eyes. Now, this is a big one. Every type of dry eye, and there's several, that demands different therapies. But here's one that I think I want to throw this statistics out, because it really bears what we do in the pharmacy to help people with dry eyes, and that is to get them to really understand that it's not just about putting drops in. There might be some other factors, and that is 86% of individuals that suffer some type of evaporative dry eye condition, which means that's only 14% who really truly just have an aqueous deficiency. So 86% have a evaporative eye disorder, only 14% just have aqueous deficient aqueous deficient eye condition. So what that means is you have to treat them differently, and you have to treat them with different therapies. And that's why sometimes if you have really long-term symptoms, you need to see a doctor, an ophthalmologist or optician. The impact on daily life, then we're going to move on. Here's the impact. 42% of chronic sufferers reported negative impact on their mental well-being. Think about that for a second. Not just the fact that their eyes itch and they're dry and they're rubbing and they're irritated. No, they say that it has an impact on their mental well-being. Think about that for a second. Economic burden, I was surprised at this, but maybe I shouldn't be. A total of $3.8 billion is spent annually in the United States on treatments for dry eyes. Crazy. So let's go through some common treatments addressing some of the dry eye symptoms. Artificial tears, aqueous drops, lubricate the ocular surface. You've seen those. People buy them all the time. Come by different brands, generics. Some are long-acting, some are short-acting. There's so many on the shelf to choose from. I usually help somebody pick something out if they need it. But the bigger question is, how long have you been suffering from this? Because if they've been suffering for a while, they need to see somebody. They need to see an ophthalmologist or optician. Lifestyle modifications. Here's another treatment. You wouldn't believe it, but it's true. Drinking more water and having more humidity in the air makes sense, right? Also, omega-3 fatty acids. Some of these things might help reduce some of the symptoms. Prescription medications, absolutely. There's several of those. Anti-inflammatories and modulators, we have a lot in our arsenal that are there. You usually only prescribe a healthcare professional that does have to also monitor, especially if you're using some steroid, which usually is not to use much, but an anti-inflammatory eye drops, yes, they use steroids sometimes. So anyway, but for dry eyes, there's a lot of therapy. Some are very expensive, but they're there. Punctal plugs, that's for people who have really severe symptoms. They can actually put a block so that the tears don't go through the duct and drain out as quickly. That's interesting. There's many other innovative therapies. There's stem cell research being done, some advanced ocular surface reconstruction. There's a lot of things in the pipeline that might help. But I want to talk and close with this. There's an adjunct therapy that I think a lot of people, they really don't look at it too seriously. It's a holistic approach. It's called heated eye mask therapy. And there's a lot of heated eye masks out there. Some you throw in the microwave. That's the usual kind that most people know of. But I'm talking about a heated eye mask that's USB or electric, that's sustained heat, that you control the level of heat. Much different. And there's one that we use called the Oncologic mask rolling out right now that I found my patients would benefit a lot from, because it's variable temperature 1 to 5, and then they can also set it for the amount of time, so 20, 30, 40, or 50 minutes. But here's what it does. A heated eye mask will help if you have, especially evaporative conditions. It will help with the meibomian glands in people that have evaporative disorder with their eyes. It's because they have a lack of the meibomian, they call it meibomian gland disorder, where the glands are not releasing that oil because the oil is thick and not thin enough to come through onto the surface of the eye, which if that oil comes out on the surface of the eye, you have less evaporation of the aqueous fluid. So unless you correct the oil problem of the eye for the meibomian glands actually getting the oil out, then you're going to have a problem with dry eyes. Now, here's the thing. If you can heat the meibomian glands a little bit, then that oil becomes thinner, and instead of being like Crisco, it becomes like olive oil, I guess. It actually comes out. Once you correct that, you correct a lot of the dry eye symptoms because the evaporation will take place quickly. A lot of patients say that when they have a heated eye mask, that's also improved ocular comfort. They just feel better having the mask on. It does a lot of things to soothe the irritated eyes. It has a lot of good immediate relief. Using the mask, for 7 to 10 days to find out if it's going to help with your dry eyes is one thing, but the immediate relief occurs when I start using it. That's amazing. Number 5, they're convenient and accessible. You got it by your bed, you turn the button on, you change, the duration, and you change the temperature you want to go with, and put it on. And when you're done, you take it off. But so convenient, so easy, so accessible. They're non-invasive and they're safe. And it's a very good holistic approach to maybe help adjunct therapy to your dry eyes, which might be due to the MGD, the meibomian gland disorder, which again can be diagnosed by your ophthalmologist or optician. So that's just my recommendation. On the website, you can in our blog, you can come to RxHealthyHabits.com as a blog and there with all this information and a lot more. You can also click on the link in our blog and it'll take you to a website where you can read about some of all the other uses for heated eye masks that's going to blow you away. Some for stress relief, some for sleep, some maybe an adjunct to help with some of the symptoms from migraine. I use it twice a day. I'm sold on it because I also had a problem of having frequent styes and I want to make sure I could prevent those, and this really does help reduce the incidence and the severity. So I'm on board. But heated eye masks, got a lot of people just love the stress relief and help them sleep, so many other factors. So hope that helps. As always, come to our website, RxHealthyHabits.com for more information, and I hope the information today is going to help you get a handle on your dry eyes because you shouldn't have to suffer with them. God bless.